Hello and welcome to the FH Foundation Lipoprotein A Community Forum for 2021. My name is Kat Davis Ahmed and I'm Vice President for Policy and Outreach at the FH Foundation. And I really am so glad that you're all here for this terrific event. This is our first ever Lipoprotein A or Lp(a) Community Forum. And we're looking forward to a terrific discussion with Dr. Abha Khandelwal and our terrific panelists, Susan Riley, Gail Titus, and Misty Vota. Just a few items that I want to cover before we get started. This is a discussion of people talking about their personal experiences, and nothing presented here on this webinar should be considered medical advice. Please talk to your doctor or your medical team for specific recommendations about your own treatment for you or your family. It would be great if you all introduce yourselves in the chat. Make sure you choose everyone when you choose the mode, and introduce yourself. Say where you're from, something about what brings you here, so everybody can meet each other virtually in this virtual world. And if you have questions throughout, there'll be a Q&A time towards the end. But please, throughout the event, put your Q&A in your questions into the Q&A, and Dr. Khandelwal will field your questions at the end for our panelists, and we really welcome your questions. The FH Foundation is really grateful to our sponsors of the Lipoprotein A Community in Action Program. This is the first year that we have that program, and we're grateful to Amgen and to Novartis, to Konica Medical Products, to Silence Therapeutics, and to Bio for their support and making this and so much else happen this year for the Lp(a) community. And as always, we're very thankful to our FH family partners, families who stepped up to support the work that we do. So with that, I would like to introduce Dr. Khandelwal, who is the Clinical Associate Professor in the Division of Cardiovascular Medicine at Stanford University School of Medicine. And she serves as ambulatory clinic chief for CV medicine there, and an imaging cardiologist who specializes in the treatment of patients with elevated lipoprotein A, and particularly women's heart health. She co-leads the cardio obstetrics program, and she completed her undergrad and a master's in science at Case Western Reserve University, her MD at The Ohio State University College of Medicine, and her residency and fellowship training at Rush University Medical College in Chicago. She's board certified in cardiology, nuclear cardiology, and echocardiology. Dr. Khandelwal has focused her career on caring for women with cardiovascular disease and Lp(a), and her current clinical research focuses on elevated Lp(a) and valvular heart disease, cardiovascular disease in women, and heart disease in the South Asian population, which is so important. She serves on the scientific advisory board for the Lp(a) scientific advisory board for the FH Foundation, and for that we're very grateful and honored. Her expertise encompasses health systems and practice management, clinical cardiology, cardiac imaging, clinical research, and medical education. Her source of energy and strength comes from her two children, ages 8 and 6, and their husband of 20 years. And we're so grateful that you're spending this time with us to host and moderate this terrific panel that we have. And so I'll hand it over to you, Dr. Khandelwal, to give us just a quick overview, and then to introduce our panelists, and I'll be back at the end. Thank you so much. Oops.
Thank you, Kat, and I want to thank the FH Foundation for organizing this community forum. I think it's very, very important that we talk about today why we should be testing for lipoprotein A. And we're very lucky to hear from our panelists about their perspectives on this very important question. I think, the first thing that we need to understand is that the cholesterol that we're talking about, the FH Foundation has some wonderful webinars for in-detailed discussions of the science, treatment, and kind of more detailed information about this. But briefly speaking, I have an image here on the left of what an Lpa molecule looks like. It is a relative, you can think of an LDL particle, and you can see that in the middle. And unfortunately, it is more of a triple threat than just a standard LDL, because it not only has a portion that makes it pro-atherogenic or helps build plaque up, but it also has these additional features that have pro-inflammatory, meaning having inflammation in the blood vessels effect, as well as a pro-thrombotic or clotting effect. And this can lead to a variety of cardiac manifestations, including having an ischemic stroke, having aortic valve stenosis, heart attacks, or peripheral arterial disease. So I'll have you advance to the next slide. And there are multiple ways to measure lipoprotein A. There are two standard units that we measure them in. One is milligrams per deciliter, and the other one is nanomoles per liter. And largely speaking, we consider a normal value to be less than 30 milligrams per deciliter or 75 nanomoles per liter. That being said, our research at the FH Foundation indicates that even in the US healthcare system, out of 300 million patients, only 500,000 have actually been tested for Lp(a). So this is a problem. And so I would really like to spend the rest of our time talking with our panelists and learning about their perspectives of what we can do to increase awareness and reduce the barriers in this condition. So with that, thank you. I'd like to start off with inviting Misty Votow to introduce herself and tell us when you first learned about your LPA diagnosis and a little bit about what your initial response was.
Hello, my name is Misty Votaw. I am 46 and I live outside of Waco, Texas. I found out about my elevated Lp(a) about a year and a half ago after a family member had an event. I had known that I had high cholesterol since I was young, but I had never even heard of elevated Lp(a) until I got tested by a preventative cardiologist.
Thank you, Misty. Can I invite Gail Titus?
Hello, my name is Gail Titus. I live in Bucks County, Pennsylvania, Newtown, Pennsylvania, just outside of Philadelphia. I am 61 years old, and I learned about having elevated lipoprotein A 24 years ago as a result of a relative experiencing pericardiomyopathy.
Thank you, Gail. May I invite Susan Riley to?
Sure. Hi, I'm Susan Riley from the great state of New Hampshire. I am a wife, a mom, and a nana, and that is why I'm here. My family, I am not biologically impacted by Lp(a). My family is. And we first learned about heart disease about 17 years ago when my husband had 2 stents placed. About 3 more stents later, we were introduced to what lipoprotein A is and what it can do.
Thank you, Susan. So oftentimes when we first get a diagnosis, the next step is to kind of act on that. But for one reason or another, sometimes we're unable to. Can you each of you briefly tell me what happened after the diagnosis? Maybe we can begin with Misty.
Sure. After I was diagnosed initially, I actually found out through a patient portal, so I didn't really know what to do with that for a little bit, and I did a lot of Googling, which is kind of crazy. It's a little overwhelming in the beginning, especially when you don't really know what you're looking at, but that's actually sort of how I ended up finding a network of people to help me with the FH Foundation as well, too. There's just a plethora of information and a community of people who are also experiencing the same sort of things.
What about you, Gail? What happened next?
So, as a result of my cousin experiencing the pericardiomyopathy after the birth of her daughter, her cardiologist encouraged her to let as many family members know about the elevated lipoprotein A. And so I did consult with my primary care physician. And as it turned out, I tested and I did have the elevated lipoprotein A. And then fast forward to 2018, I actually had an event myself. I experienced a retinal artery occlusion, and that's really what sent me down the path. I was clinically diagnosed with FH. I, of course, have already knew about the elevated lipoprotein A. And as a result of visiting a lipidologist, that's how I found out about the FH Foundation. And certainly they have helped me in many ways. As a matter of fact, the way I found out about the particular lipidologist that I'm working with was actually as a result of hearing about the FH Foundation.
So before I move to Susan, I actually want to ask both you, Misty and Gail, you know, the internet and Google have become great resources for people when they first get a diagnosis. Was there any tips you can give our listeners on kind of things to look for, things to maybe avoid when searching the web?
I would say just finding a place that has reputable information instead of sort of, you know, going down rabbit holes that might be a little alarming or have, you know, contradictory advice. Just to find a place that, you know, the information is good and that you have sources on the webpage that you can reach out to people individually. And the response has been super. Everyone at the FH Foundation answers questions, answers phone calls, emails, is always there. So I think just making sure you find a reputable, and then also the Facebook groups are really great too. Just finding other people who are dealing with LP(a).
And any other tips, Gail?
I would agree with Misty that it's very important to focus on credible articles and resources. And as Misty alluded to, I typically will refer to just the FH website or also the Facebook groups, the FH and the LP(a) Facebook sites. And I have met so many other people who have FH and lipoprotein A, and it's a nice space because you're reaching out to people who truly understand what it is to live with these conditions.
Yeah, and I want to just advocate for sometimes my patients will actually bring in articles if they're not sure. So please feel open to bring articles that you may not be certain about to your healthcare providers. We want to be a part of the conversation too. Susan, what about you? Did you do a bunch of Googling after your husband's 5th stent?
We did. We did. And when we went to the lipid specialist, we found out that it was a genetic condition. And he suggested that we have our children tested because only one parent needs to carry it to have it passed, a 50% chance to pass it on to your child. So we had our children tested. I have 3 children, 2 came back as high lipoprotein A. That was about 10 years ago. And we were told that diet and exercise to keep the LDL low, that was the treatment. And it really was how we lived until January of this year, when my 23-year-old daughter passed away of a heart attack in her sleep. And that's when it really took all of us by surprise. But even though my husband was sick, I don't think we ever saw that it could happen to someone so young. And that's when I really searched and we found the FH Foundation. And they have so much information on their website that's important to know what LP(a) can do and how silent and deadly it can be. And so it's important for me to be here to share my story and my family's story so that we can educate and help mitigate it from happening to any other family.
Susan, that is quite a impact in your life, I imagine. And how have you been able to kind of get through that?
Well, being an advocate helps. I think being able to share Catherine's story, being able to share my family story, feeling like I'm doing something to help others has helped me. It's helped me learning because, again, 2 of my children have it. So I have a son who's fighting and my husband is still working through it. And so it's important for me to keep going and to keep fighting and to keep educating and to put a face with this disease. And it's not necessarily someone in their 30s, 40s, 50s. It happens to children. It happens to young adults. And I really need people to know that.
What about you, Misty? How has it impacted your life?
That's actually why I'm here. I lost my oldest sister at 36, and we kind of thought it was just sort of a freak thing that, you know, it would never happen to anyone else. Although my father had had a heart attack at 40, we had a very strong family history of heart disease. You know, it just still didn't seem like that was what was causing it. And then about a year and a half ago, my middle sister, who was 48, passed away as well. And that was kind of when, you know, it hit home that it was not a freak thing. And it was a much bigger issue. And that's when I was tested. And that's also when I found out that my two daughters also have elevated Lp(a). So I think, you know, my message and why I'm here is hopefully just to spread as much awareness as I can to help families avoid tragedies like this.
How do your daughters, were they fairly young when they were tested, and how did you help them understand the diagnosis?
And no, they actually, this has all happened sort of, you know, recently. And so they were 20 and 25 at the time. You know, it's a lot of information to absorb, especially when you're a young adult. You know, but I think they have seen firsthand the impact that it has had. So I think they were a lot more interested in finding out more about it. And, you know, through the FH Foundation, I mean, I hate to keep saying the same thing, but I just feel like it's been such a lifeline for us. And finding physicians through the FH Foundation that provided you know, even a lipid specialist to sort of help us understand and sort of break things down for us to a level that we could understand a little bit better was a really big thing.
What about you, Gail?
My family has experienced tragedy also as heart-related tragedy. My father passed away at the age of 58. He had a fatal heart attack. I don't really know whether he actually did have FH or if he did have elevated protein A, but the side of the family, the cousin that had the pericardiomyopathy was on my dad's side of the family. And so as a result of my dad's fatal heart attack, and then when I had the retinal artery occlusion, I was just looking for answers. I have 2 children and 3 grandchildren. And so it was very important to me to learn more about heart conditions, specifically FH and lipoprotein A, and to encourage my family members to be tested. And I have found that just the advocacy work, it's a message that needs to go to a lot of people because these are conditions that are so highly undiagnosed.
Mhm.
When you speak of advocacy, can you elaborate on that a little bit more? Are you speaking regarding kind of educating the community? Are you talking about providers? Are you talking about the government? Tell me a little bit more about the advocacy that you think is important.
Well, in 2020, I went through training with the FH Foundation to become an FH advocate for awareness. And so that was really the first part of, I would say, the advocacy as an FH advocate. And then, of course, over time, advocacy also relates to lipoprotein A. And so the focus is to try to speak to providers, speak to community members, speak to family members, just tell as many people as we possibly can about the importance of getting tested. Early detection of heart disease is really the key, getting the diagnosis early.
I would love to add too that my primary care physician did not even know what elevated Lp(a) was. And so when we asked to be tested, he actually gave us the wrong test initially. So I think it's really important for people to advocate for themselves, especially when people don't always know even what the condition is. So if you are equipped with all the information that you can be when you go in to your physician, before you can find a specialist even to get tested, I think that's really important, because I've spoken to so many people, even physicians and nurses, that don't even know what it is.
Have any of you experienced barriers such as this, or other barriers in the treatment or diagnosis that you think is important for people to hear?
I can really relate to what Misty shared, because when my cousin first asked me and other family members to get tested, when I went to my primary care physician, he was really very uninformed about lipoprotein A. And I was able to share the information that my cousin had given to me as a result of meeting with her medical team. And it turns out she's an ER physician, so she's been to medical school, and so she was able to help me to understand, because she could take it from, you know, the medical terms into layman's terms that I could understand. But that was really helpful, because I was able to impart that information to my primary healthcare provider, and to try to kind of help him along, because he was not familiar with elevated lipoprotein A before we had that initial discussion.
I have a couple of things to say on advocacy. The first one is that it's my mission in life to be Catherine's voice. And as part of that, my daughter, Courtney, who is a pediatrician, and I have been meeting with physicians and clinicians to show Catherine's pictures, to change the narrative, and to get Lp(a) on the radar. And I will continue to do that until my last breath. But I also think it's important for the patients to understand that they need to be their own advocates. There's information out there, the foundation, the FH Foundation is wonderful. And then I want to speak to the patients who are the young adults, the first time they're going into their PCPs by themselves. Remember that you have family heart conditions. You may or may not know you have lipoprotein A. You are your own advocate. And if you don't understand, ask questions. Of your physician, if you don't get the information you need from your physician, find the information. And like you said, doctor, bring it to them and say, this is what I found on it. But you have to be your own advocate. Only you know what's going on in your body. Pay attention to those signs, trust those signs, and own it. Just because you're younger and they're older does not mean you don't have a right to your own health care.
Yeah, I couldn't agree more, Susan. So I want to, elevated Lp(a) is a fairly common condition. They say 1 in 5 individuals can be affected by it. How do you kind of internalize and process that statistic?
So for me, 1 in 5 is huge. And yet we still don't understand it. Like, I know how my daughter passed. She had a heart attack, but I don't know why she had a heart attack at 23. Heart disease is the #1 killer. It takes away our families every day. And yet we still don't understand the underlying conditions, which could be directly related to Lp(a), 1 in 5, underdiagnosed. We could be doing so much more if we knew how prevalent this actually was. We have an idea of it, but it's not front and center because not enough people are tested. We have to test people, and we have to test them in childhood.
Well, and the 1 in 5 statistic for my family was essentially 4 in 5, so, I mean, that doesn't do you a lot of good if you aren't aware. And at least if you're aware, then you can do something about it and be proactive.
Right.
Yeah, I mean, I think knowledge, as a physician, that's the one thing I do my best to impart to my patients, is that knowledge is power. What you do with that knowledge, ultimately is up to you, but you should at least have that information. What do you think the role of, have any of you been enrolled? Because there are some studies ongoing for patients with elevated Lp(a) in some clinical trials. Have any of you been approached or enrolled?
I have been approached. I actually did not enroll, but I was approached about it mainly because of the history of elevated lipoprotein A, and I had sustained the retinal artery occlusion. I live fairly far away from the place where I would have to go on a routine basis, and so I did not actually join the study, but I certainly hope to benefit from the ongoing work. I have several friends who are in the study, and so I'm, of course, very optimistic about being able to take advantage of the different medications that are forthcoming.
Yeah, Misty, what about you?
Yes, this is a point that I'm really passionate about because I had an ischemic stroke, which is not considered an event for many of the trials, which is really frustrating to me. It's something that I would like to see change so that we could maybe get some patients in trials for preventative reasons, as opposed to people who have already had events, so that maybe we can stop some of this tragedies like we all have had.
And I'd like to add to that, because I agree with you, Misty. We can't wait till an event happens. Catherine's first event was her last event. Waiting for an event is too late. It's too late. I agree.
Yeah, it speaks to clinical trial design and study design, you know, things like distance traveled, frequency of visits. We really have to advocate to our clinical trial leaders to design trials that are doable and address the population that they affect. So I think that's very important as well. So tell me a little bit more in terms of current day, what you think kind of the next steps are for people listening to this call in terms of understanding and knowing about Lp(a).
I would just say, you know, if you have any family history whatsoever, if you can't find a physician that's willing to test you, then find a different physician that would test you, and don't take no for an answer, because it really is the difference between living and dying. Like Susan said, you know, sometimes your first event is the thing that kills you. And you know, if there's any indication whatsoever, even if you're not sure if other people have had elevated Lp(a), if there's been any history of stroke or heart attack in your family, get tested and advocate, and, you know, fight. Also fight for medications, fight for insurance, whatever you have to do, just keep advocating for yourself.
I agree, Misty. I think that actually we should be universally tested for Lp(a). But if we can't have that, at least if you see a patient who has a family history of heart disease, start with the Lp(a), work on the lipids. If they're elevated, treat them as such. We have to be able to catch this early so that we can prevent further progression of the disease, if at all possible.
How do you, if let's say we have, I don't know of all the participants on the call, if we have someone who decides funding for research or for testing, how do you convince them the importance of this maybe once in a lifetime test versus some of the, you know, how they distribute funds to things like breast cancer research or other treatments?
Heart disease is the #1 killer. It even was through our last years. We need to understand more about the heart disease so that we can mitigate the impact it has on families and your own lives. Having to live with the loss is something that I would not want to happen to anyone. And cancer is a horrible, horrible way to lose someone. More people are losing to heart disease. We need to be able to get the funding to understand it, to get better drugs, to get better treatment, to treat earlier, to treat more effectively. We need funds for that.
I would say even just the conversation. People know to check their blood sugar when they go to the doctor for their yearly visit. They know to be getting mammograms, you know, all the other things that you're supposed to be checking. And lipoprotein little a is just not even a conversation that people have.
So in terms of, I've been looking at the chat a little bit as well, and you know, some folks have indicated that their physicians or providers may be a little bit reluctant to test, whether it be via cost or telling patients they don't need them. How do you, as a patient, address something like that? What are your suggestions for these individuals?
Testing is key. It really is. And Misty alluded to advocating for yourself to the point where if you are working with a physician that refuses to test you, move on to another physician that will test you.
My understanding also is that there are some blood tests that can be done out of pocket. I know it's not the ideal solution, but if you're having trouble, that may be another option as well. Moving on, tell me what you think about the next steps for advocacy and research. What would you like to see as the next steps taken?
I think,
Personally, oh, go ahead, Susan.
okay,
I was gonna say, personally, I just feel like I'm in a holding pattern, a wait pattern for when the drugs that are in clinical trial become FDA approved and available to the general population. So I just feel like I'm in hold mode.
Are you going to say something, Susan?
I sure was. I think advocacy, I think if you're interested in being part of the solution, the FH Foundation is a great way to get your word out. Without them, I would not be able to share Catherine's story. I think we have to keep moving forward, and we have to keep pushing, and we have to keep pushing the envelope to whether we go to Congress or to the medical boards. We have to make our voices heard. And I think that is the next step, at least for me and my family. We're going to pound the pavement as long as we can to make sure that we move this discussion forward and the treatments forward.
I think even on a small scale, people can have a voice and make this conversation something that we can get to be a bigger thing where, you know, if you're just sharing posts on social media, if you tell one person, if you educate your physician who may or may not know about it, if you can just get one person, you know, to hear what you have to say, and then that one person starts a conversation, I think on a small scale, it's really possible to make change as well.
Yeah, I definitely think kind of your sphere of influence is a very powerful thing, and we shouldn't underestimate that. I'm starting to see some questions in the chat, and I'm wondering if I should move to that. But before I do that, just one last question, and I know some of you have already answered it, but I just want to give an additional chance if there's something I've missed. How has the FH Foundation played a role in kind of this whole process for you? And are there other support systems or mechanisms that have been in place for you that have helped you through this time?
I mean, for me, there's been people, specifically Kat at the FH Foundation, who when I had questions, I could email her, and she has always provided information for me and given me sort of direction on people in my area, which that information is also available on the website. You can find people in your area. And then joining the Facebook group, just sort of having, you know, being able to bounce your thoughts off of other people who are going through the same thing, or maybe people who are just diagnosed who need guidance or need just somebody else that they know has the same sort of issues. Those two things I think are really, really important.
Any other additional comments, Gail or Susan?
Oh, one thing I would like to add as a result of being affiliated with the FH Foundation, I am enrolled in a program where over time, whenever I have my labs drawn, that information automatically goes into a huge database. I guess there's some artificial intelligence involved. And so I feel just in some way that I'm making a contribution in terms of further research, which I feel happy about that given kind of the long haul that we have with finding out information and research, et cetera. So that's another component, the research component of the FH Foundation, I think is very key as well.
Susan, you were going to say something.
Yeah. So when my daughter passed away, my oldest daughter and my mother and I knew we had to do something. This wasn't going to go, her passing was not going to go unnoticed, for lack of a better term, but we didn't know how to do that. And then my oldest happened to have a meeting with Mary McGowan of the FH Foundation, and the doors just started to open. We knew we had to be part of this because, again, we knew we had to be part of the solution. And the FH Foundation has given us so much information, so much support. We have found our extended family here, and we just know that being part of this organization is going to change the way the world looks at lipoprotein A.
Yeah, I mean, already some of our guidelines, the European Society does recommend testing. I think, here in the US, we still have some work to do. One question I'm noticing also pop up here is for people with young children, how do they reconcile this risk with also kind of trying to minimize health anxiety and making sure the child can lead somewhat of a normal life? Any tips?
I mean, my kids were not little when we found out, but I mean, still being young adults, I think it's overwhelming. I think the important thing is to focus on all the things that you can do, as opposed to the things that you can't really do to change your numbers, and sort of try to combat some of the other risk factors that you have.
Yeah, I agree. I think that's usually how we counsel folks in our clinic as well, as there are some things that we have within our control and some things that we don't. And so to focus on the things that are within our control.
I think,
Okay.
Sorry.
No,
I think you do have to let them be children first. But I also do think, and maybe I'm going to speak to the physicians that are on the line here. When you have a patient, regardless of age or activity level, or physical appearance, if they have high lipoprotein A, it is a silent and deadly disease. If they do come to you presenting chest pains, chest discomfort, don't brush it away, because it actually could be their heart. So to the parents, let your children be children. Make sure you're consistent in having their lipids checked. You don't have to keep rechecking the lipoprotein A, but just make sure that the cholesterol is as low as it can be, and be their advocate, and then teach them to be their own advocate when they age out into their own PCP relationship.
Yeah, I mean, I think that's actually a common theme that I hear for a lot of the women I see in my Heart Center for Women, is that they've been to other places saying that they have symptoms and were often diagnosed with anxiety or stress, and that is really disheartening to hear, because though in some situations that may be the case, it's important to kind of really do a thorough workup of the risk factors and really understand that LPA is not benign. Have either Gail or Misty, did you have any issues with your diagnosis when you had symptoms? Were you misdiagnosed, or did you?
Definitely for me, when I had my stroke, it was kind of one of those things where you're 40, you're healthy, this is likely not what's happening to you, kind of thing. Just sort of feeling like you are being sort of brushed under the rug type of thing. It took a lot of convincing for me myself to even go to the hospital, because I sort of thought this wasn't what was happening to me as well. And then when you are told or not taken very seriously when you go, it's very disheartening, and it's hard in that moment to fight for your own health as well.
I did experience a rather lengthy delay after I had the retinal artery occlusion. Of course, when my sight just wasn't very good for several hours, of course, I had no idea I was having a retinal artery occlusion, but it did take really 2 weeks before I actually did get to an ophthalmologist. And I saw my primary care physician the day after, but he really didn't think, I remember him saying, it's not vascular, it's not vascular. And it turns out it was vascular. So fortunately, I didn't lose any visual acuity, but in hindsight, it was a situation where, shame on me, I really should have gone to the hospital immediately, and rather than get the diagnosis 2 weeks later.
Yeah. There are several questions in the chat about treatment options. And I think the FH Foundation has a very nice website that can actually lay out all the upcoming clinical trials in detail. But, just broadly speaking, I don't know if any of the panelists wants to share their personal experience, but broadly speaking, the cornerstone of treatment still for Lp(a) is modification of the other risk factors, utilizing statins, and if appropriate, PCSK9 inhibitors, which is another lipid lowering therapy. And last but not least, in certain indications, plasmapheresis is approved. So, for an in-depth understanding of those treatments, I would refer you back to the FH Foundation website. And then one other question is for the panelists, have you had your Lp(a) checked multiple times or just once? What is your understanding of what happens to Lp(a) over the course of your life?
Well, I'm at the point now where I generally get it checked about twice a year now, as a result, really, of having had the retinal artery occlusion. And in terms of my care team, I see an ophthalmologist, I see a retinal specialist, the lipidologist, the cardiologist, the primary care physician. So I'm very fortunate that I have a care team that I trust. But I would say before the retinal artery occlusion, I really had not had the lipoprotein A checked since that first check, which was, my goodness, 24 years ago. And that was the first time I had it checked. So I had a very long period of time when it had not been checked. But now just to see where I am, about twice a year.
Mine is more, usually, at this point, about a year, every year. But there's, what I'm being told is really there's not a lot of reason to continue to do that. It's more about controlling my LDL and my other risk factors, keeping my LDL low.
Yeah, oh, go ahead, Susan, please.
Children should be tested for Lp(a). It doesn't change much in your lifetime. So once you know you have it, it stays pretty steady. And then if you're a woman, probably after menopause, that's what I would suggest.
Yeah, and that's what our science would indicate is appropriate as well. And then there are some questions about niacin in the chat as well. And again, I would indicate that that would be a discussion with your doctor on whether that is an appropriate treatment for you. And then there's a question in the chat about how can, and I know we've addressed this briefly, but maybe we can be a little bit more specific. He asks, how do you advocate for kind of the things we talked about in clinical trials? And I'll start off just speaking from a physician and a clinical trial PI, is I'm constantly talking to kind of the advisory boards. I'm doing my best to have patient panels on trial design, and really explaining to them that oftentimes, especially for women, having frequent visits is a very big barrier to enrollment, because they are often the caregivers. They are often the ones that can't take the time off work to come to these visits. And interestingly, a couple of, 5-10 years ago, that was a big barrier. But now with COVID, we've learned all of a sudden how to do things remotely quite quickly. So I think that moving forward, hopefully that will change. In addition, I think actually going into the communities that are traditionally underrepresented should also be a priority for a lot of these drug companies, and a lot of the kind of the funding they need to look at, because where you recruit from will tell you kind of what population you're recruiting. So making sure you have a diverse recruitment area is also important. And then, just making sure that as a person, when you're looking at these protocol designs, are these things that are feasible for a working individual? So I think those are the things that I've advocated for on my front. I would love to hear from the panel on what they think could be done.
For me, I have been really interested in any kind of trials. So I think, and also having a good cardiology team, they're going to try to get you into things when they see that there's a need to. But I think just expressing your desire to be in them too. Every time I go, I'm like, hey, what's happening? Are there new things? Can I be involved? So just asking those questions and letting everyone know you want to be involved if there's an opportunity.
Very good. So, I want to kind of, I'm a practical person by nature. And when we hear about these stories, our natural instinct is to want to do something. And what is one thing that you would want the participants to do after hearing this talk?
Get themselves tested and ensure that their family members and friends get tested. Spread the word, spread the word. Susan talked about how heart disease is so prevalent, and it's all about knowing your numbers. LDL, HDL, Lp(a), know your numbers.
Susan?
I agree with what Gail said. So as patients, we need to know our numbers. We need to be advocates. As physicians, we need to be aware of what the signs are, and we need to know the family history and keep the family history up. If there's known heart disease in the family, code that. Let that be in every conversation. Maybe not for a cold, but we have to keep an eye on that part of our healthcare. Our heart health is important.
Misty?
I would say, just people think it won't happen to them. And it does. It does happen. And, a lot of times it's too late when you find out. And, we spend time on other things that are less important. So I feel like, just really just do this, if it's not a problem, great. If it is, and then, I wonder a lot, how would that have changed, for my sisters if we had known, and that would have been such a simple thing to know. So, I think that's the most important thing, is just any family history, whether or not that it was directly related to Lp(a), any family history, just, go get tested. And if you find out that yours is elevated, then urge everyone in your family to do the same.
Yeah, and as just some final thoughts from the participants, what are your hopes and kind of wishes for the future, looking out kind of a little further out for patients and families that have been affected by this condition? What would be your goal or your dream to see?
Treatment for Lp(a), and not just the things that can mitigate what Lp(a) can do to your body. I would like to see real treatment for Lp(a) itself.
I would concur with that. That's my hope. That's what I'm waiting for.
Well, and I think making available drugs that people can afford. A lot of times, you know, people have an issue with getting them covered by insurance or not having insurance or whatever the case may be. And there are medications on the horizon specifically for LP(a). So hopefully those will be things that will be available actually to the people who need them, who can afford them and actually get them.
Yeah, I mean, I think I share your sentiments. You know, my hope is that we understand the structure, the molecule much better, so that we can really find targeted treatments, just as Susan had said, and really have a different narrative in the future about this condition, much like some other um, health conditions have had in the past. And, you know, with that, I'd like to kind of thank all of you for sharing your stories and your time and your voice. It's one of the most powerful things. I'll tell you, even I've been practicing in California for a little over a decade, and I even now my patients will still bring up stories they hear from their friends and families, and that's what leads them to action. So please continue to use your voice, and make sure that we all learn and know more about this condition. And I want to take a moment to thank Kat and Megan and Susan and the FH Foundation for putting together this lovely panel and forum. So with that, I'm going to turn it back over to Kat.
Thank you all so much. That was really incredible. And we so appreciate that you're sharing your own stories. They are difficult stories, and but you are making a difference. And huge thanks to Dr. Khandelwal for a great moderation. I think I heard just some really important themes, and I thought I would reiterate them. I also want to thank everybody who commented in the chat and gave such great questions. It was really wonderful to see your engagement. So the themes I heard were, of course, the importance of testing and asking for a test, and that even if today treatment options are limited, that information is so powerful and helps you to advocate for your own healthcare. And so I think that helps really to answer this question of why test for LP(a). And so testing, finding the right healthcare team, it was one of the themes you all raised, and I wanted to point people to, we have a searchable map on the FH Foundation website where you can find a specialist in your area who understands high LP(a) and FH as well. So it is so important. It can make all the difference. And then, of course, advocating for your own health. And the key barriers that you all highlighted were the LP(a) testing. A bunch of our participants were sharing how you can get direct LP(a) testing in a relatively affordable. Somebody posted $39. So I think that's something we'll get some more information on that at the FH Foundation and make sure it's easy to find for people, because it's not always covered by insurance. And that is certainly something that the FH Foundation will be advocating for, is for insurance companies to cover the cost of LP(a) testing when they may not. And then, of course, as Susan highlighted, the need for treatment options, that they're limited today. We have a great webinar on lipoprotein apheresis and its role in elevated lipoprotein(a), cardiovascular disease, and FH. And I really recommend people check that out if they want to learn more about. That's the one FDA approved treatment for lowering LP(a). And then we have two great webinars on LP(a), one by Dr. Khandelwal and one by our own Chief Medical Officer, Dr. McGowan, that really explain what the treatment options are, what the clinical trials are that are ongoing today, and the role of statins, the role of niacin, really important questions that people raised in the chat and the questions. And we have a place on our website where you can search for clinical trials. And we are at the FH Foundation doing a lot to connect people with the pharmaceutical companies so that they can hear directly from patients about what their priorities and concerns are. Misty points out, of course, the really important need to cover people with for primary prevention as well. So I want to make sure people know they can find out more on our website about clinical trials. about Lp(a), about FH, cholesterol, lipoprotein apheresis. And finally, I think one of the themes to me that I heard from you all is how important more research is into, what is the effect of lipoprotein A? As Susan so powerfully said, why did Catherine have a heart attack so young, when we know that other people with high Lp(a) might live much longer? And so the FH Foundation is absolutely committed to partnering with researchers and also doing our own research at the FH Foundation with real world data and in healthcare systems to better understand what the lipoprotein A population looks like and what the cardiovascular impact is, and that should help inform better care in the future. So I just want really such a terrific and impactful conversation. I'm so grateful to you all. And I have a few slides to share at the end just to thank everybody and give you a little more information. Here's where you can find our webinars, and also on YouTube are our webinars. We would love it if you would like to join the ranks of these incredible women, Gail, Misty, and Susan, and become an advocate for awareness. We have both Lp(a) advocates for awareness, FH advocates for awareness, people with polygenic hypercholesterolemia, and we really would love to have you join us. So check out on our website and send us an application. We'll have a training in 2022. And we're so grateful to the support that we get from the community. It really shows what this work means to you and that you value it and you help us help keep it going. So we're really grateful for any donations, especially in this season of giving. And we'd like to thank you all. Thank you, Dr. Khandelwal. Thank you, Misty, Susan, Gail. We really appreciate the time and the sharing. And this is how you reach us at the FH Foundation. And please watch for new developments. We have a lot going on at the FH Foundation, and we hope you'll sign up for our newsletter and be the first to know about what's coming up next. Thank you all.
Thank you.
Thank you.